The topic for the day is bilateral combined retinal vascular occlusion on exposure to organophosphorus compounds. Aim was to report a case of bilateral combined vascular occlusion on exposure to organophosphorus compounds. The patient details are as follows. He is a 40-year-old male with occupation pesticide sprayer in farms since 20 years. History. Patient presented to our hospital with a history of diminution of vision in both eyes since 4 months. No issue of pain, redness, flash of light, floaters, trauma, or ocular surgeries. He is an own case of diabetes mellitus type 2 diagnosed 6 months back and is on oral hypoglycemic agents. On ocular examinations, the visual acuity was hand movement positive and projection of rays was inaccurate in all the quadrants in both the eyes. The rest of the anterior segment was normal. On moving on to the dilated fundoscopic examination, dilated fundoscopic picture of both eyes showing features of combined vascular occlusion. The red-free filter also showed the same features. Then moving on to the fundus fluorescent angiography, the FFA is showing the nil perfusion in the right eye, the left eye showing perfusion only around the optic disc, probably due to the development of the collaterals. These are the sequential fundus pictures which were actually taken in the right eye. Then moving on to the left eye. The systemic evaluation was done and the chest X-ray was normal. The random blood sugar was 95 mg%, the blood urea was 25 mg%, and creatinine was 0.9 mg%. The serology was non-reactive, serum electrolytes, the liver function test, and the inflammatory markers, ESR, ECG, were within normal limits, and even the MAN2 test and the sputum CVNAT were negative. The complete blood count was within the normal limits. APLA was also done, and IgM and IgG were both within the normal limits. Then moving on to provisional diagnosis of bilateral combined vascular occlusion, secondary to probably organophosphate retinopathy was thought out. The pesticide sprayed by the patient in farm since the 20 years is shown as follows. The treatment, the patient was started on oral steroids with a tapering dose and very guarded visual prognosis in both the eyes were explained. The follow-up visit after 15 days, vision in both the eyes, after 15 days, the vision in both the eyes improved to 1/60 with no changes in the fundus findings. The right eye and the left eye fundus pictures are shown. Patient is on the regular follow-up. Moving on to the discussion, organophosphates are a commonly used pesticides worldwide. All organophosphate pesticides share a common mechanism of action. It mainly includes the competitive inhibition of acetylcholinesterase enzyme, which in turn results in the deacetylation of the neurotransmitter acetylcholine. The inhibition of the acetylcholinesterase enzyme resulting in the lower levels of acetylcholine may interfere with the retinal neurotransmission. Alternatively, organophosphorus may generate free radicals leading to oxidative stress in the retinal neurons and the retinal vessels. The Palm et al. Reported a case of bilateral retinal degeneration characterized primarily by a geographic maculopathy due to the chronic and acute exposure to dimethoate. The Kiran et al. Found an elevated risk odds ratio of 1.9 with a 95% confidence interval is equal to 1.2 to 3.1 of retinal degeneration in wives of farmers who were actually the pesticide applicators. Camel et al. Studied the retinal degeneration using a standard questionnaire. The licensed pesticide applicators were interviewed for the use of pesticides. There was significant risk of retinopathy in the pesticide applicators. Jaga et al. Published a review article on ocular toxicity from the pesticide exposure. They emphasized that unprotected eyes to the pesticides results in absorption in the ocular tissues and potential ocular toxicity. Conclusion, as in the case presented with no systemic illness or inflammatory condition, the possible cause would be chronic exposure to organophosphorus compounds. Due to the guarded visual prognosis associated with the combined vascular occlusions, all the occupants or individuals in contact with the pesticides are required to undergo dilated fundoscopic examination at a regular interval. Prompt diagnosis and treatment can provide the useful vision as in the case presented. Thank you, sir.